So I'm going to talk to you about Candida albicans, also known as yeast. So it's in our natural flora. It's found in the GI tract, the mouth, and the vagina, and this is because it has the ability to survive in multiple pH levels. Overgrowth and infections commonly occur, which we will talk about in a little bit. It's the most prevalent cause of fungal infections, and albicans comes from the Latin word white because the yeast appears white when cultured on a plate. C. albicans is extremely adaptable and versatile. It's pretty cool. It actually has something called chitin, which is a known anti-inflammatory, and now scientists are looking to try to use it to treat chronic diseases such as irritable bowel syndrome, arthritis, and any other kind of diseases that may cause inflammation. Here are the plates cultured. You can see the white I was talking about earlier. C. albicans can also form a biofilm, which you can see here, which explains how persistent it can be. And here is just a design of it. So we're going to talk about some of the C. albicans infections that a person can acquire. So the first one is urinary yeast infection, or UTIs. It's the most common cause. It can occur in the lower portion and can ascend into the kidneys. Risks include those who take antibiotics, use certain medical devices such as catheters, those with diabetes and weakened immune systems like HIV patients. Antifungal drugs such as fluconazole is a common treatment. They can also use other antifungals. It just depends on the person what works better. The real problem with this happens when it runs up into the kidneys. Also, those with kidney stones seem to get this a lot. But when it runs up in your kidneys, it's extremely painful. It's a long hospital stay, and it is no fun. So next we have oral thrush. It's the overgrowth of Candida albicans in the mouth, which leads to thrush that creates patches in your mouth, as you can see here in the picture. So it can develop in your mouth, tonsils, throat, and sometimes the esophagus. Those at risk are, once again, those who are using antibiotics, uncontrolled diabetes, immunosuppressed individuals, and those who wear dentures. And treatment is, once again, antifungal medication. Those who wear dentures are really where you see this a lot, just because they don't keep their dentures clean, they lay them around, they don't change the water, they're not washing them like they should, and they're going in their mouth. And at the same time, they're not really checking their mouth and cleaning it properly like they should because they think they don't have teeth, they don't need to brush their teeth. So this is mucocutaneous candidus. It infects the skin and mucous membranes, and mostly, once again, caused by Candida albicans. It is caused by warm, moist, or sweaty environments and overgrowth of yeast. Risk factors include tight undergarments, poor hygiene, such as infrequent undergarment changes, taking antibiotics, and those, once again, with a weakened immune system. Treatment includes antifungals and steroid creams. And babies can get this if they wear a diaper too long. Outdoorsmen get this a lot if they're camping and it's rainy or wet. It's not uncommon for workers to get this on their feet if their feet become wet. So another one is genital yeast infections, which is just a yeast infection. The bacteria Lactobacillus keeps yeast production under control, but when disrupted, overgrowth and infection occurs. Oral sex can cause yeast infections. Risks include antibiotics, uncontrolled diabetes, immunosuppressed individuals, pregnant women, and those using oral contraceptives or hormone therapy. Over-the-counter prescription antifungal cream, pills, or suppository can be a treatment as well as oral or antifungal medication, and it's fairly common in women, but that does not mean men cannot get it. And here's a picture of it. So we're going to talk about the problem that arises with C. albicans because the diseases we talked about are kind of mild, but there are some serious parts of it. So it can create diseases such as Candida, which is when it's in your blood, endocarditis, which is when it builds up around your heart valves, and meningitis, which is when it builds up around your brain. It can lead to system-wide infection, which will ultimately lead to death. Candida species are responsible for 15% of nosocomial bloodstream infections and are associated with a mortality rate of 71% when widespread. There aren't any new antifungal medications being made, And this fungus is smart and it's catching up and it's building resistance to antifungals. And so we are trying to make things that can resist it.